You're listening to Simple Health Radio, the podcast about recognizing medical emergencies and promoting wellness. Your host is Dr. Emron, an experienced ER physician who has treated thousands of people just like you. Information on the show is not a substitute for professional medical advice. Always talk to your doctor or go to the nearest emergency room with any questions you may have.
Thank you so much for joining me on this week's episode of Simple Health Radio. I'm your host, Dr. Emron. On today's episode, I will discuss a patient I saw recently in the emergency department. His name was Zach. He was 26 years old, a healthy, young African-American male who came in with a 1-week history of severe chest pain. Now, Zach was actually a gym teacher, and he was a very active individual, a very good athlete. He took care of his body, took care of his health, but the chest pain was bothering him so much that he could not sleep. He described the chest pain as being very sharp and shooting, and it interfered with his basic activities like getting dressed in the morning. The pain was worse with sneezing, although he didn't have any fever and he wasn't really coughing. He had no family history of any heart problems, and he himself had actually no medical issues. He didn't have any injury that he could recall. He did not have a car accident. He didn't do anything out of his normal routine. But the pain just continued to bother him to the point where he couldn't go into work and he was not able to perform his duties as a gym teacher safely. Now, when I saw Zach, I examined him, and he was very tender over the sternum, which is the mid part of the chest, the breastbone, and he was also very tender on the left upper side of the chest. But all of his other physical exam findings were normal. His lungs were clear. He was not running a fever. He had no cough, and he was able to talk in a full sentence. I did some basic testing on him, which included a chest x-ray. That was normal. He had no signs of any broken ribs. He had no signs of any fluid on the lungs. He had no evidence of any pneumonia. I did an EKG to look at his heart rhythm, which was completely normal. His pulse was 65. His rhythm was completely healthy. And I did some basic lab tests. So he was not diabetic. His sodium and potassium were normal. His kidney function was normal. He was not anemic. And he had no signs of any elevated white count, which told me he did not have any active signs of any severe infections. Now, after I did all of that testing and I spoke with him a little bit further, I realized that he actually had costochondritis, and that's what we are going to discuss on today's episode. Costochondritis, by definition, is inflammation of the ribs and the cartilage. So the chest and the rib cage are a unique part of the body. We actually have 12 ribs on each side, so 12 on the left, 12 on the right. Some of the ribs are complete, meaning they go from the spine, they wrap around all the way to the front, and then they insert into the sternum. But the last few ribs are called floating or half ribs, so those are sticking out. They start from the spine, they go outwards, but they don't come all the way back up to the sternum. Now, the sternum itself is cartilage, so it's similar to your ear. You can actually bend the cartilage. It's not really made of bone, so it has a little bit of flexibility to it. The ribs, of course, are not very flexible, and so we have to be very careful. For example, if you get hit in the chest wall, if you have a car accident, if you have any injuries to the ribs, they have a little bit of flexibility, but not a lot. The sternum is going to be the most flexible part in the chest cavity. So in this gentleman's case, when we talked about Zach, he's a healthy man, no medical problems, but the chest pain was getting worse and worse. The reason I called it costochondritis is because I ruled out all the other causes and the pain was reproducible. So when I pressed on the sternum, when I pressed on the left upper ribs, it actually caused the pain to become worse. And when he sneezed, the pain was worse. When he turned a certain way in bed, it made the pain worse. And so by definition, he had all the criteria for costochondritis. I don't know exactly what caused the costochondritis because he really did not have any physical injury that he could recall. However, it's possible he may have changed up his exercise routine. It's possible he may have lifted some heavy weights or moved a sofa or a table at school. And oftentimes you don't feel the pain on the first day. It may take 2 or 3 days for that pain to increase, and then it becomes overwhelming. And I believe that may be a possibility as to what happened to him. And the last possibility is that he had a mild infection caused by a virus. Enough of an infection to cause inflammation in the ribs, but not enough to run fever or have a cough or any of the other symptoms. Now, in the United States, there are more than 600,000 cases of costochondritis and chest pain, especially in young, healthy, active adults and teenagers, and I would consider him to be in that category. The difficulty is that these are people who oftentimes wait it out, meaning they try over-the-counter medications like Tylenol or Advil, and they try to do anything they can to avoid coming to the ER. If the pain goes away, that's fine, but in this case, the pain worsened. And so by the time I saw him, he was very, very miserable. Now, the treatment that I offered Zach was a combination. I offered him prescription NSAIDs. NSAIDs are medicines like ibuprofen, naproxen, Aleve, even aspirin. These are all types of NSAIDs that help to reduce the pain and the swelling, and they are non-drowsy. I also offered him steroids, which would be similar to prednisone or Medrol, and these can be used to reduce inflammation if the NSAIDs are not enough. And then I recommended a short course of Tylenol with codeine, which is a narcotic, and that was really just to help him sleep. So these are medications that are used as needed on a brief amount of time at the lowest dose to hopefully give some relief until the episode passes. Eventually, within about 1 to 2 weeks, the worst of the symptoms will go away, but they can always return, especially if it was related to exertion or exercise, and especially if he's still exposed to his workplace, which involved children, where he could be exposed to viruses, bronchitis, and other infections. So I advised him to be very, very cautious in the future. Now, in his case, I did not recommend a chest binder. A binder is sort of a large Velcro ace wrap, if you will, and people can, in the old days, they used to apply it to the chest in cases of pleurisy or pleuritic chest pain. A pleuritic chest pain is similar to costochondritis, but a little bit different because of the organs that are involved. We don't recommend chest binders anymore because people can actually develop breathing problems, including pneumonia, if they use chest binders when they're not necessary. So in his case, as an active, healthy young adult, I advised against it. He did improve over the next several days. When I called him for follow-up, he was almost pain-free, and I felt that we were on the right track, but I advised him that he may need to follow up with his doctor to do some additional testing just to be sure there wasn't a rib fracture or something occult, meaning something hidden that I wasn't able to identify. If you or any of your family members have costochondritis, please share your experiences with us. Were there other treatments that you found very helpful? Was there some other information that you wish you knew at that time? I would love to connect with you on social media, especially if you have other ideas or feedback regarding costochondritis and chest wall pain. You should never ignore chest pain. It can be very, very serious and potentially life-threatening, so always go to the nearest ER or talk to your doctor about any questions that might come up. Otherwise, I hope you enjoyed this week's episode, and I look forward to having you again next week.
We hope you enjoyed this week's episode. Visit simplehealthradio.com to read the blog, follow links mentioned on this episode, and easily share content with your family and friends. Subscribe to the show on iTunes, Spotify, YouTube, Spreaker, iHeartRadio, and the 3 and Out Radio Network. Be sure to connect with Dr. Emron on Twitter, Facebook, Instagram, Pinterest, and Tumblr to send us your questions and ideas.